We are now live. To you, Lanice.
Okay, good evening. My name is Loyce Williams, and I'm an executive committee member of the Women in Global Health's Washington, D.C. chapter. First, I'd like to thank you for joining us at a critical and uncertain time in the global community. We are pleased to collaborate with HIP Politics to host this event in conjunction with this year's historic World Health Assembly. The World Health Assembly is the decision-making body of the WHO, which includes delegates from all 194 member states. Traditionally, we will be in Geneva, Switzerland for this deliberation. However, we're online for the first time and excited to use this opportunity to reach a new audience. This evening, we will discuss how to continue to address the COVID-19 pandemic while building equitable health systems and strengthening global institutions. There is a stark inequality in healthcare delivery and outcomes, especially for women of color in the United States and globally. Globally, women make up 70% of the healthcare workforce. As primary caregivers, women are at greater risk of infecting their families and most vulnerable due to the lack of personal protective equipment. In leadership, women are a critical component to addressing the challenges of the COVID-19 pandemic. Support for the World Health Organization and other global institutions are critical to the global response to limit a global health crisis. The organization, Women in Global Health, was established in 2015 as a movement to elevate the leadership of women in global health institutions and expand gender equity in the delivery of healthcare around the world. WGH engaged stakeholders from all global health organizations, governments, civil society, foundations, academia, professional associations, and the private sector. We have more than 26,000 supporters from 90 countries, and our DC chapter has a network of over 200 members. Now I'm pleased to introduce HIP Politics founder and executive director, Cameron Trimble. Cameron is a marketing and communications professional in both the government and entertainment fields. He's a strategic communicator, crafting and executing marketing plans and branding unique digital content. Please welcome Cameron Trimble.
Hi, thank you so much. Thank you so much, Lanice. Welcome everyone to another one of our HIP Politics virtual forums. Our event today, the health impacts of COVID-19 on women, building more equitable health systems through global cooperation. We have a wonderful panel here today and our great moderator. So first, I'd love to introduce our moderator, Ms. Loyce Pace of the Global Health Council, who will kind of be leading this discussion. And for our first panelist to the stage will be Congresswoman Stacey Plaskett. Congresswoman Stacey Plaskett is the at-large representative to the U.S. House of Congress from United States Virgin Islands. She's an attorney and practiced law in New York City, Washington, D.C., and the U.S. Virgin Islands. Congresswoman Plaskett is a member of the House Committee on Agriculture, the Committee on Transportation and Infrastructure, and the Committee on Oversight and Government Reform. Since taking office in January 2015, Congresswoman Plaskett has embarked on several legislative initiatives aimed at improving the economy of the U.S. Virgin Islands and the underserved communities she is an advocate of, utilizing creative government programs like infrastructure development, educational support, and social impact investment. She is also a strong advocate for our servicemen and women, and recently introduced legislation that will help returning veterans secure employment. So please welcome to the stage Congresswoman Stacey Plaskett and our moderator, Loyce Pace. Thank you.
Well, thanks very much, Cameron, for that introduction, and welcome everyone to our event this evening. I wanted to thank the Congresswoman for her time today as well. And I know, Congresswoman, you have a few remarks for us, so I will go ahead and pass it over to you, and then we perhaps can have a brief discussion between us and perhaps some audience members who are keen to hear more from you. But again, thank you for your time today. I think we're especially interested in your view on this topic of how we improve equity in the era of COVID-19, knowing how much it's affecting the communities we all care about.
Thank you so much. I'm really grateful to be on this Zoom, this call with you all, this YouTube Live. And I want to thank you, Cameron, for always bringing really interesting topics to the forefront on this channel. I think what's really interesting is, the COVID pandemic has really brought to light issues which were already in discussion by members of Congress, particularly those of us who are members of the Congressional Black Caucus. In the last Congress, Congresswoman Bonnie Watson-Coleman, Yvette Clarke, and others started the caucus on Black women and girls, which I think was brought about to really try and highlight those issues and the tensions that Black women in America face. And not just for women, but for our girls as well. We talked about hair discrimination in school. The fact that so many of our girls were being pushed out of school, suspended, and having unnecessary discipline done on them. We've also talked about inequities in the workplace as well as healthcare, talking about the mortality rate for Black maternal health, I think was an issue that we really tried to highlight before the pandemic started up. But I think what COVID has really done is really brought to the forefront those issues that were already on the minds of Black women in America, and those individuals who were woke to the issues that people of color and particularly women are facing. When you look at the pandemic, I'd like to break it up into a couple of issues. Of course, we discussed the healthcare issues, that being, of course, the already prevalence of longstanding healthcare issues that women of color face, whether that be hypertension, diabetes, asthma, which of course are exacerbated by this disease if one gets the virus. And then on top of it, these recent studies which have shown how often Black women, when they go to healthcare providers, their symptoms are dismissed or ignored by healthcare providers and those in the healthcare field. So that has put us on a trajectory to be at an even higher risk area than others. But there are other things, I think, which has exacerbated the effect of COVID on Black America and particularly women of color. Let's talk about food insecurities. Of the Black women over the age of 65, 60% of those live well below the poverty level, at 200% below the poverty level. 60% of our sisters who are 65 and older. That food insecurity really points to so many other issues, whether they be health or economic. When we look at the savings that people have, never mind the fact that Black women fall into those areas and those services that we know that are on the front line. We're nursing, the top jobs of Black women in this country are nursing assistants, grocery store cashiers, working in personal care aides, customer service areas. Those are individuals who are on the front line, and we know that they are underpaid. Black women are less likely to have savings. When you look at a statistic that says that a single white male has within his wealth an average of $28,900. Single white women have $15,640. Black women, $200. That is frightening. And the notion of people being furloughed or laid off and what savings that they have, that presents a whole nother level of insecurity for Black families. 50% of Black households being headed by single women, and 38% of those single Black female headed households are people living in poverty, are families living in poverty. Those are the issues that I'm so glad you guys are talking about today, and that the Congressional Black Caucus and many of my sisters in Congress are really striving for, really trying to make sure that we're in the conversation, that not only are we sitting at the table and representing Black women, but that they are doing things that really inject the issues that are important to Black women and how we can be protected during this time. The last area that has really been something that has been very much on my heart is domestic violence. And research has recently come out by Johns Hopkins that they believe that there will be 31 million more cases of gender-based violence if the lockdown continues for 6 months. And the other much more vulnerable group in my mind are our children who are subject to abuse in homes. without being able to go to schools, not having that outlet there. That's something that I've been really praying about and trying to figure out with other members of Congress in the House and the Senate, what can we do to create safety nets for those children who are living in those unstable homes, who are in shelters, who are on the streets, who are homeless during this time. So thank you so much for the opportunity, Loyce, to just share a couple of those ideas and those thoughts. And if you and I and others can have a dialogue, I'm happy to do that right now.
Thanks very much, Congresswoman. I really felt a lot of what you had to say and appreciate you not just talking about the health risks, which I think we all can appreciate, but also this idea of more hidden epidemics, if you will, around food, poverty, and of course, abuse and violence. And so hoping that our discussion will span that spectrum as well. With that, I will be sure to remind people that if they do have questions for the Congresswoman while she's with us, to please submit those. I do have my own, of course. We can start with those. But you talked about your sisters in the fight, and in particular, those of you in the CBC. And I just want to thank you and your colleagues for standing up for women of color in particular throughout this crisis. Wondering, though, what you see as the key selling point for others in Congress, right? Because I know that there are a lot of needs that people are wanting to meet, and there's a lot being asked and demanded of all of our leaders right now. So what do you think breaks through for people when you and your sisters in the fight are really pushing for these protections for this particular community of people, for this particular group? How does that resonate?
I think there are so many different ways to have members to feel this. And then there are some who don't and who won't, who are not concerned at all. And you see that every day on the news and in the media for those individuals who do not think that this is important, who are only concerned with their bottom line and their safety. For one, there are members who are just empathetic, who are in this fight and have come to Congress for the right reasons, that they want to serve their constituents and want to serve the American people. And when you speak to their humanity and to the rightness of it, there are many who, come on board with that. There are others who you have to bully into it. And listen, many of us, Black women in Congress, are not afraid to fight. We wouldn't be in Congress if we weren't willing to do what needs to be done and to get down and dirty with people. Politics is not a fun, it's not for the faint of heart, not for individuals who don't want to be, sweet and kind all the time. You're in the wrong business. But then there are also those members that you really need to talk to a cost benefit analysis. And, what is the cost in the long terms of not doing this on the front end? If you are not giving protective equipment to grocery store cashiers, if you're not giving assistance to the nursing assistants, you're increasing the vulnerability of a larger population to yourself in the grocery store. And so that kind of resonates with some individuals. Or what is the long-term cost, the health cost of not providing preventative care rather than providing treatment on the back end? And so you have to really look at who the individual is, what will speak to them, and really approach them at that. The one-on-one relationships do work. That's something. I was on another call a little earlier. It doesn't seem like we're all on calls all day long. And as members of Congress, we do miss being with one another because there's an opportunity to speak to someone and to look them in the eye. And have them say no to you personally rather than an email. That makes it a little more difficult for someone if you're doing it that way. And so, we all have tremendous staff who work with us, and their relationships with staff and other members' offices also support us in the cause. I think that the HEROES Act that members of Congress and the Democratic caucus put forward last week really had a lot of components in there that address issues that are important to people of color and to Black women. And now comes the hard negotiation of getting those things and making sure that those things stay in the bill that will eventually come out of the Senate.
Well, and that last point is an important one too, right? Because in reality, this is not just about or solely about Black women, or it needn't be. What I mean by that is I think there's more that we have in common with other particular groups and vulnerable populations than people realize. And I'm thinking in particular about at least individuals outside the US and sort of the global fight around all of this, because there's some recurring themes there in terms of people who are marginalized and who are at greater risk for the poor outcomes as a result of this pandemic. And so that's actually related to my next question, is how the US is, or rather isn't, showing up in the world. Especially this week, we're coming off the heels of the World Health Assembly. The president made another announcement via Twitter about his recent letter to the Director General of the WHO, and how he remains displeased about their response, and has threatened to not just retract funding, but actually dissolve the US's membership in the organization. In other words, we would no longer have a seat at the table, depending on how things play out. And so just, not that you have to comment on that specifically, although you're—
well, I don't mind.
but I think broadly, what does it mean to have that rhetoric come from the US?
Sure. What's interesting is that even when you hear that rhetoric, at least in the legislative branch of government and Congress, members continue to move on and continue to have discussions with these organizations and with other heads of state while the president is making whatever comments he's making. I can recall several years ago when he was talking about getting out of NATO, and then being invited by a Republican member to go on to a CODEL to visit NATO states and facilities to let them know that in a bipartisan manner, members of Congress were not going to be leaving NATO. And so I think, I'm always reminding people that just because the president says it doesn't make it so. On a truth level, but even on a performance level, that we continue to do what needs to be done. And, listen, despite us not being on the world stage in the manner that we believe we should, and I was recently talking with a friend about what is my relationship as a Black person with this country and with this history of this country. And I believe that I am an evolving adult with a parent who is dysfunctional, but has done some amazing things, that I need to separate the bad from the good. In the end, we're still the innovators, and we're still the leaders. When we talk about our relationship as Black Americans in this country, don't be an African in France. That's a whole another level of hatred and marginalization. Or in, the place that we all seem to love, Sweden or Denmark. That's a whole nother level of not having and not being. Don't even think about calling yourself a Swede. So
I used to live in Sweden, so I can appreciate this.
So you're nodding, right? So I think we need to recognize that and continue to push through and know that, we're all in this fight together, and hopefully this will pass.
Well, thanks very much for that. Certainly, it's powerful words, of course. I guess one other question, then bringing it back home, and maybe twinning the two, honestly, is often those of us who work globally, we hear this kind of tension between kind of the global and the local. I would argue that's a false dichotomy, right? I've worked domestically. I'm from South Central Los Angeles. I live in Washington, D.C., and I see some of the same issues, and I can understand how we can learn from each other, The world is, the U.S. is part of the globe, in other words. I would love to hear from you how you make that case, if you feel the same need to make that case. In other words, how do we go from sort of an either or concept to a yes and concept when it comes to particularly our response to this crisis, right? If we're really talking about equity, I feel we need to be talking about this holistically. And yet, I think those of us who maybe spend more time outside the US, we haven't really figured out how to translate that message, and perhaps we can do that better by focusing on on women of color, for example, as one kind of target population or focus group. But
and when you're talking about it, it's a target population across countries or across this country?
Well, I think it's an open question for me. You know, like, does it help, for example, for women in global health, the gender lens is critically important, and I think they a fabulous job really highlighting gender issues around the world. Arguably, that dovetails with some of the gender language or some of the gender agenda here in the state. But again, bringing those two together, that seemed very natural in terms of partners or collaborators. I think it's a little bit challenging, and I don't quite know how to crack that nut.
Yeah, that's an interesting one. You know, I find that myself, I don't engage in global discussions as much as I would like to. When you're a member of Congress, you're kind of made to you're driven into those areas that are either related to your constituents or relate to the committee that you sit on. And so your bandwidth then becomes so stretched that the discussions that you'd like to have, you know, if you were talking to a member of Congress who sits on the Foreign Service Committee, then this would be an issue I'm sure that they would discuss. But, you know, I think that you're correct that there are overlaps throughout the world that we need to be discussing. I have the luxury of representing an island in the Caribbean. And so I regularly have discussions with heads of states of other Caribbean islands. I was talking to last week, you know, who I told her, last year, you're now my big sister. You know, we WhatsApp text all the time, is Mia Motley, who is the new Prime Minister.
Fire.
Auntie Mia, who is the Prime Minister of Barbados and is heading CARICOM, you know, all of the nations of the most of the Caribbean. And there are gender issues that they face in the Caribbean islands that are the same that women in New York and Boston, you know, I'm sure Los Angeles are facing as well when it comes to health and gender issues. And how do we engage in that while we're so focused on our own lives and what's happening here? You know, we are constantly looking at the television and looking at, you know, how many deaths are in the United States now? What is the spike rate and where is it going to be in my home and in my city? Whereas we're not seeing this in the larger context. And I think you're so right. That's really important. And tell me how we keep doing, how we engage in that better.
Well, it sounds like you have a running start, but happy to support you in whatever way we can. And I just want to thank you again for joining us this evening. I know you need to run off at the top of this hour, but I'm sure there's sort of a round of applause.
Did anybody else have any other questions for me? I didn't see.
I think we are respectful of your time. And didn't necessarily get any questions in from folks on YouTube. So hopefully that means they were pleased with our discussion.
Thank you so much. And, you know, I just, what I would also suggest to so many of you is, it would be great and I try to encourage people to do this, is the issues that are important to you, to please reach out to your members of Congress. And organize yourselves maybe in your city or your town where you live, and do a concerted effort in that member's office on the issues that are important to you. Listen, in my office, if our staff assistant, the receptionist, gets 10 calls on the same issue, you can be sure that someone's going to be assigned and it's going to be elevated, and we're going to be figuring out how do we address that. And there are so many really strong pieces of legislation that need other members to co-sponsor and support them so that we can move them forward. So if you all would, you know, organize or go to the Caucus on Black Women and Girls, which have issues related to education and health, and gender issues of equality, that finding 3 or 4 of those that you all want to champion and support, that would be an amazing driver for us and really wind beneath our wings as we try and push those things forward. And thank you again. And Cameron, thanks for the time.
Thank you, Congresswoman.
Okay, take care.
Have a wonderful evening. Well, now, everyone, I will dive right into our panel. Again, thanks for joining us today. I think we heard a lot of great pearls of wisdom and some advice in closing from Congresswoman Plaskett. Again, she really talked about the disproportionate effect of COVID on communities of color, on women of color. And so I think we're going to spend more time talking about that intersection. And again, not just about the sort of health effects, but the financial effects of these communities separately, but then also these communities as there's some overlap. I think one thing that comes to mind for me is the importance of solidarity when it comes to this fight. I think we hear this term often in both international and domestic circles as sort of banding together towards a common cause. And I would argue that, you know, in both of these communities, for women, for people of color, and everything in between, or everyone in between, we are accustomed to coming together in crisis. And we have a history of cooperation, both at the local and global levels. And so I'd like to think that's working in our favor, that history. And in reality, we have no choice, right? We have to really come together around these issues because if not, we will suffer the consequences, and those being more dire than for other groups, especially given what we've heard from the Congresswoman and what we know otherwise. We don't really have any room to backslide, if you will. So with that, I'll go ahead and introduce the various panelists, and then I will start a conversation with them. Just as a reminder, I think some questions are finally coming in. Please do submit questions via the YouTube channel, and we'll be sure to get them on our end and get to them. But we'll have a good half hour or so to talk with the panelists for their perspectives on this issue of really reaching equity when it comes to COVID-19. So first up, just going in alphabetical order by last name, we have Gabrielle Fitzgerald. She's the founder and CEO of Panorama Global, and also is a member of Women in Global Health Seattle. I refer to Gabrielle as my epidemics guru. She was really on the front lines when it came to the Ebola outbreak and working on issues that people rarely recognize, which is at a global partnerships level, really trying to convene heavy hitters around response to that particular outbreak, from the tech sector, from major donors to government leaders, corporations, and the like. So really glad to have Gabrielle join us today. Next up, we have Lisa Hayes, who's acting executive director of the Georgia Global Health Alliance. She's with Women in Global Health Atlanta. And Lisa is sort of a UN whisperer in my mind. So she's done a lot of work with those agencies as we talk about multilateralism and global cooperation. I think some of these terms really hit home for her, and I'm hoping we can dig into that as we talk to her about her take on this issue. And then finally, we have Dr. Kamara Jones, who's a fellow at the Radcliffe Institute for Advanced Study at Harvard University. She's also past president of APHA, the American Public Health Association here in the States, and a member of Women in Global Health, Washington, D.C. I could describe her in so many ways. I think first and foremost, or I would say, especially in this moment, first and foremost, that we appreciate her service as a frontline health worker, as a physician, but also as a researcher. As an epidemiologist, she is also understanding the data and varied trends that, again, affect these communities about which we're speaking tonight, and put these communities at risk. But also she's very aware of the social determinants or other drivers of those outcomes. And so I'm sure she'll share a lot with us tonight in that regard. But going back up the line, my first question is for Gabrielle, and really hoping that she can talk about a couple things and some introductory remarks to us. First is, well, in both respects, I'm seeking from Gabrielle what she believes is our call to action or our collaboration in this moment, particularly when it comes to addressing issues of gender and racial equity and the intersection of those issues. How are you in your work, Gabrielle, really focused on kind of what the call to action should be across partners or across stakeholders? And I'd love for you to answer that both at the global level, so what the global call to action is for those partners, and then also what the local call to action should be right in your backyard. To the Congresswoman's point, a lot of us are also focused there and trying to toggle the two, but appreciate anything you have to share with us in that regard. Thanks, Gabrielle.
Thanks so much, Loyce. So honored to be a part of this. Have a lot to say, so just trying to figure out where to start. So going back to what the Congresswoman said on, or actually might have been you, Loyce, on there's really no distinction between global and local with this epidemic. There's some degree of irony to think that earlier in the year, we were thinking of this as a virus that came from China. And I had the opportunity to do some work travel and came back to Seattle, where I live, right around the time when the first deaths occurred in the US. And so there was, if we hadn't realized it before, I had been kind of concerned traveling that perhaps I was going to run into someone that might have the virus, but in fact, I was perhaps the bearer of the virus in my travels. And so I think that if we didn't realize that there are no borders, there are no barriers to disease transmission, we're all part of the same situation here. So given that, as Loyce said, I've been pretty passionate about pandemic preparedness since I worked on the West Africa Ebola outbreak in 2014 to 2016. Being involved in that, it was just a very, very bad situation that you wouldn't want anyone to have to go through again. And so there was a lot of panels and commissions and lessons learned about what we should do. But as is traditionally the case, the world moved on. We did not take a lot of those lessons. We moved on to other priorities. And so now my fervent hope is that we are, as we are all collectively facing COVID, we are both investing in pandemic preparedness while we fight COVID. And then going to the point of global and local, I think it's really fascinating to watch as an observer. So many of the lessons we learned in the Democratic Republic of Congo's Ebola outbreak last year, in West Africa, the heavy focus on contact tracing, on community health workers who are predominantly women. And so all of those practices that were used in other parts of the world are now being implemented in every state in the US. And as we look at gender and racial equity, of course, many of these frontline workers are women of color, and therefore have a higher risk of exposure. So when we think about it, you asked that I think about kind of a call to action globally and locally. The first call to action is this has to be a global response. So, perhaps it's naive to say this is no time for politics, but, we really shouldn't be collectively, we should be focusing on the solution and how to get to a solution, and then spend time figuring out what went wrong and how we're going to do better next time. So that would be my hope, is that we can really look at how we can have as much solidarity, as you said earlier, around a solution. That's our global call to action. One other thing globally that we're looking at from an equity perspective is there are huge inequities in access to materials that we need today, like personal protective equipment, testing. As we look around the world, there's huge competition between rich and poor countries, even in the US, rich and poor states and cities. As we go further, and there's a lot of talk about the vaccine as kind of our silver bullet, there's also a risk for huge inequity about haves and have-nots in terms of who gets that vaccine. So going back to your question on call to action, I think we all need to be fighting for equitable distribution of these supplies, and that's a global and local call to action. Supporting health workers and frontline workers, global and local. And then I guess in your, specifically in our backyard, what can we do to help the communities who are most at risk, whether it's, time or treasure, or, whether it's volunteering or writing a check, whether it's dropping off supplies to a food bank. Those are the most local things you can do. But I hope, and thanks again to the Congresswoman for inviting everyone to reach out to their member of Congress. Please be active, please share your voices, because we need everyone in this fight. So I'll stop there. Thanks, Loyce.
Yeah, no, thanks, Gabrielle. I think that's helpful, and it gives me something to pose to the other panelists as well. So, Lisa, you have been looking at this or working on this in the past from a multilateral level. And, Gabrielle, excuse me, put out a few things. And one was this idea of innovations really being accessible in an equitable way, right? They really should be universal. How realistic of or feasible of a call to action do you think that is within the UN system? In other words, is there, too much bureaucracy or too many politics at the UN or at WHO to make that happen? Or are there examples you can share where we've been successful in that regard?
Well, I think that's a very good question. Thank you, Loyce, for asking it. I think that the UN gets a lot of negative press lately, and I want to point out that they do a lot of good work. And the UN family not only works across each other, but they work with governments, they work with bilateral aid organizations, and they have inroads into all regions of the world. So if we look at reach, they are a necessary partner, and they are an integral partner to doing anything that is going to address equity. I think that the role of WHO is also not often understood. They are a normative agency, and they provide guidance. They don't actually go out there and do the work in the field in the way that we might think they do, or that an average person, their perspective is. But they're really out there, trying to create those norms and guidance. And UN Women, I think, is doing good work. There's a lot more work to be done, but thinking about how they take that data that they're learning, which has many, many gaps, but how do we actually translate the data into actions that are equitable? So I think every country, actually signed on to the Sustainable Development Goals, and that is ultimately a goal for equity, right? Where poverty reduction cannot happen unless we understand the role that women play in our societies and their important role. And not only that we actually address this in leadership, but that we address this in all aspects of our work. We need to ask other countries what they want and not assume that we have the solutions. Every place is different. Every place has their own political and cultural and social contexts. And by ignoring those, we're not respecting them.
Well, and I think that last point was really important. Just as you were making it, we had an audience question come in about kind of this global North dominance versus the opposite of that. I hesitate to say global South, but whether you say low and middle income countries, whether you just talk about country ownership and partnership, but having these issues be driven from the ground up is increasingly important. It's long been something we should have been doing, but I think especially now, it's ideal. Would you want to speak to that at all, Lisa?
I think that there are many unintended consequences of what is at the time thought to be a good idea. And if we think about women and girls, especially in sub-Saharan Africa, we are dealing with the consequences of our different lending policies that have been going on for 40 years since decolonization. And so these aspects aren't simple to solve. They need to include everyone. right? We can't solve it alone, and we can't expect the UN to, or the World Bank, or the US government, or a bilateral aid agency to be effective or to create sustainable change by telling someone what they need, instead of working with them to understand their situation, to understand how that would work. How are they going to measure this? How are they going to, show success? But I think that oversimplifying these issues actually makes it harder, because we are trying to get out of that lens of, I know what's best for someone else, into that that lens where we are trying to understand their point of view, because nothing's sustainable unless it's actually, wanted.
Completely fair. Dr. Jones, I see you nodding your head along to this point.
Yes, but nothing specific to add. I mean, yeah.
Well, I can imagine though that this is something you bump up against often in your work on social determinants. This idea of or really the commitment to ground up approaches, right? Participatory approaches. And I'm curious to hear, and for others to hear, about your experience at kind of local and global levels, right? Like what actions are taken that might be similar or different from each other. What's the language that people are using in both settings, or if not, whether or not like there's even a difference between the two.
Well, I'd like to jump into that question by first saying that my work has typically been about naming, measuring, and addressing the impacts of racism on the health and well-being of the nation and the world, but that I recognize that the definition that I provide for racism can be generalized to be a definition of any system of structured inequity. So I'd like to share that definition and then talk about how that's a definition of sexism, and then jump to why I was nodding so vociferously. How can you nod vociferously? I don't know. Lots of rocks in the head, I guess. But anyway, so I define racism. I'm going to say the sentence definition, and then I'm going to break down the important parts. So I define racism as a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what we call race, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. And that definition can be generalized to be a definition of what is sexism. That's a system of structuring opportunity and assigning value based on gender that unfairly disadvantages some, unfairly advantages others, and saps the strength of the whole society through the waste of human resources. And that definition of racism can be generalized to be a definition of any system of structured inequity. And in all of our societies, in any country, in any city or town, there are many, many different axes of inequity operating at the same time, intersecting in communities, intersecting in people, right? In the US context, I focus my work on race as the axis of inequity and racism as the system, because racism is foundational in our nation's history. And yet many people are in staunch denial that it exists and has profound impacts on the health and well-being of the nation. And the interesting thing about the COVID-19 pandemic and how it's been playing out in the United States, and the fact that people, thank God that Milwaukee County was the first county or city that I saw release racially stratified data, and that was no accident. Somebody can ask me about that, like what's the background of that, but that was like no accident. But since then, all of a sudden, a few people are waking up and like, oh my God, racism, right? Yes, oh my, without recognizing that racism is the root cause of, the differences in diabetes prevalence we have, infant mortality rates, maternal mortality rates, all of this stuff. People woke up a little bit with Hurricane Katrina in the United States. Oh my God, racism. They woke up with the poisoning of the Flint water supply in the US. Oh my God, racism. But then in this country, we just slip back into what I'm now describing as the somnolence of racism denial. So it is my intent that we not, as a nation, and certainly as the world, because racism has its fingers in all of this. When we talk about even, lending policies and all of that, even folks in African countries at first are like, what am I talking about? Racism? Then, oh, your colonial history. And sometimes we have to talk about it as imperialism or colonialism. I mean, we have different words, but it's the same racialized capitalist phenomenon happening across the world. So I said I was going to say all that and come back to your question. The reason I was nodding so much is that it's important when we name these systems of structured inequity to ask the question, how is racism operating here? How is sexism operating here? How is, heterosexism operating here? And the way that you answer that question is by looking at elements of decision-making. The elements of decision-making are in our structures, which are the who, what, when, and where of decision-making. And that's very important. Who's at the decision-making table and who's not? What's on the agenda and what's not? Whose perspective, whose voice is invited? So if structures are the who, what, when, and where of decision-making, then policies are the written how of decision-making. Practices and norms are the unwritten how of decision-making, and values are the why. And so actually, asking this question, how is racism operating here? How is sexism operating here? Whatever system of structured inequity you are going to focus on, you have to ask that to identify levers for intervention. Before that, you have to name the system of inequity. So I say we have to name racism, then ask how is racism operating here? And after that, you have to organize and strategize to act. And I agree with everybody who's spoken that collective action is where we have our power.
Yeah, no, amen. Thank you, Kamara. I appreciate that. And I think that, you talk about power and influence and decision-making. Women in Global Health really focuses on this as well, right? They're obviously interested in and committed to change for the masses and equity for overall. And yet, really, a lot of how this initiative and this work started was really looking at the top and wondering who is in charge, right? Who really is calling the shots. So Gabrielle, be really interested in hearing from you in that regard. And after Gabrielle, if others want to chime in, that'd be great.
So I'll start locally. So I founded our Seattle chapter of Women in Global Health about 1.5 years ago. And I think we have at least 800 women who have joined, which I think to me shows the hunger for both professional networks as well as a desire to grow in a leadership role in the global health world. So that's kind of the most local example. But when you go up to the most senior levels of leadership in this COVID response, it has been written extensively about some of the women leaders who have been, or some of the global leaders who have been most successful in fighting COVID have been in those countries led by women. So Jacinda Ardern in New Zealand, Angela Merkel in Germany are repeatedly cited as making the most progress. And so when you look, obviously there is a dearth of women at the global political level, but also at global leadership level in global health. And so I hope that through both the grassroots work of these women in global health organizations in Seattle, DC, and many other capitals around the world and other cities around the world, and the fact that COVID affects all of us and there is so much need for leadership, that I hope that the opportunity that in this crisis, it will provide an opportunity for women like the prime ministers I just referenced to really show their leadership and be able to rise and create the next generation of leaders in this time of crisis.
Let's hope that would be a great lesson for everyone to learn about the value of women leaders in crisis. I mean, again, it's something we all knew already. But Lisa, you are in Atlanta, and I was curious to know how you all are thinking about this in the chapter or emerging chapter there.
Well, so our vision at the Georgia Global Health Alliance is a world in which collaboration leads to global health equity. We're just getting our Women in Global Health chapter launched right now. And so we're working on really defining those concrete ways to implement this intersectionality lens in all aspects of our work. So, I really have to defer to learning from y'all about how to do this. One thing though that I do want to point out is how important this is, and just echo what Gabrielle and Kamara have said about this problem exists here. And I think we like to have this perspective of ourselves as if we are perfect. And whenever there is somebody gets uncomfortable, right, it becomes a personal attack instead of an acknowledgement of, you know, maybe my own privilege, or maybe my lack of understanding, or my lack of, you know, just of knowledge of how people live in this world that aren't me, right? So I think that this is not just an intentionality of women in global health in our chapter, but I think it should be intentional to everyone that we are running into today. And especially given that so many women in our community here in Atlanta and in Georgia have lost their jobs, or are working from home and are taking on the second shift. Not only are they taking on their regular second shift, but they're homeschooling their children. And the bulk of all of this keeping families together and keeping things together is falling on the women. So I just want to reach out to this audience and say, let's have a lot of compassion, and understanding should be our center from wherever we actually interact with anyone these days, or at any time.
Well said.
I actually have a question.
Oh, well, I actually am going to my last question. So,
Well, can I ask Lisa and Gabrielle first? Can I ask them a question first?
Okay, I will give you a rare
tiny time
allowance. Maybe they can work it.
I just wanted to.
Go ahead.
Well, okay. I don't want to throw you off, Loyce. Go on. I'm good.
Kamara, I want to hear what your burning question is. And
my burning question is recognizing that often people organize at the top level at which they feel they're on the closed side of an open closed sign. I have an allegory I'm referring to, but if people haven't heard it anyway, you can understand that there might be an open closed sign, and people who are inside that room, that restaurant, and are always looking at open don't even know there's a two-sided sign going on, while those on the outside where it says closed are very well aware that there's a two-sided sign going on, because it says closed to them, but they can look through the window and see people inside eating or doing business. So my question is really about the composition of the chapters in Seattle and Atlanta, the racial composition of the women in global health chapters. This is, so because I'm unafraid of controversy, I'm just lifting up an issue that that maybe, I'm wondering if it's mostly white women who are recognizing the women aspect, but may not so much recognize the racial aspect in the United States, or is it like for me, so I'm talking about racism, but I'm not recognizing my American privilege in the global context, you know, so like I'm working at that thing, but I'm not working really trying to address the global inequities in terms of banking and all of that. So I'm just wondering, really, in our lives and perhaps in our organization, is that something that we're seeing even in the sponsoring organization, or one of the two sponsoring organizations for tonight's conversation? So I just throw it out.
great question, Lisa. Gabrielle.
So for the Women in Global Health Seattle, I don't know the data on the composition of the participants. I do know the advisory committee that drives the decision-making was selected to reflect a lot of different types of diversity. And so I know that that is fairly diverse and fairly reflective of the Seattle community. I would say the overall membership, the 800 or so, is probably predominantly white, which is probably reflective of the people working in global health in Seattle. So that's my understanding of the demographics.
I don't have information on the demographics because, as I mentioned, we are just now beginning to launch our Women in Global Health chapter here in Atlanta. I do think these are extremely important points because, as I was saying earlier, unless we actually know of, we have to be able to name the problem in order to actually solve it, right? And you need diverse perspectives because I don't have the answers, right? And I'm not claiming that I have the answers, but I do know that I don't know, and that's really important to be able to admit that and understand that everyone that you're bringing together has to add that value of what you don't know. So the diversity, is inherently important, again, for sustainability. It goes back to what I was saying earlier in this discussion about, we are all working together. This is not an opportunity or this shouldn't be a situation where we're talking to or talking at. And, I think that we have had, I've heard it called all sorts of things, the stale, pale male perspective here in the US, and it's guided global development since its inception, since the inception of the UN. And it's going to take intentionality to really infuse the voices of all of you here and of the populations that we hope to work with and serve.
Thanks for that, Lisa. Appreciate it. And thank you, Kamara, for that question and letting me tease you. Too, I know that the Georgia chapter was actually established by a woman of color. And so it's been great. It's been great to have her leadership. I'm glad that she's been able to pass the torch, but I'm hopeful that people like her can remain involved and sort of give you guidance and all of us guidance with regards to how we cast a wide net when it comes to this work that we do. But I want to turn to the last question that actually came from an audience member, which is the only reason I wanted to be sure to get to it. We landed in a pretty predictable place, talking about our leadership as women and as women of color and the value of women leaders and leaders who are people of color or women of color. Given everything that they or we bring to the table, what's our call to action to them, right? Like, what can they do or say as messengers to really bring the issue of equity in global health, US and international health, to the fore? Maybe I will back to Kamara with this question and really see what she has to say to this audience member who's wondering, hey, well, what can I do, right? Like, as a person in this space, and how can I bring people along so that we can build our network of champions?
I'd like to, I'm good for like frameworks, so I'd like to offer a framework for all of us who want to be about health equity, social justice in our work. And I have distilled 3 principles. I know there are many more, but I have distilled 3 principles for achieving health equity or social equity. The first is valuing all individuals and populations equally. So you have to ask yourself, in my work, am I doing that? Am I making space at a table or even going to other people's tables because I value the work they're doing? They're not even trying to get everybody to come to my table. Am I in a chapter of women in global health, not just talking to people who consider themselves or have positioned themselves as leaders in global health, but people from other parts of the world who could inform our work on global health. So it's a different perspective, right? So valuing all individuals and populations equally is the first one. The second is recognizing and rectifying historical injustices, which could be international historical injustices or within country historical injustices. But you cannot have health equity unless you both recognize and rectify those. And then the third of these principles for achieving health equity or social equity are providing resources according to need, not equally, but according to need. And I've been thinking about this even with the census, because people are bracing themselves for what they're already seeing is turning into an undercount in some communities. And then all of a sudden it occurred to me, well, why should resources depend on the number of people that you've counted in a place, especially if you recognize there's an undercount. What if we as a federal government in the US said that we're going to provide resources according to need? It doesn't even matter if all of your people went online and completed the census, although if you're listening to this, please go online and complete the census. Anyway, so those are my 3 principles. And I would say that that could guide our work in our individual levels. It could guide our work, globally, wherever you are. If you want to be about health equity, valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need.
Thank you. Values and justice and resources. Great. Gabrielle, 3-point plan, or 1.
I know it's kind of hard to top that. That was so coherent. I guess, when I'm thinking about this conversation through 2 lenses, the COVID pandemic and diversity and leadership. And so I'm really focusing on the resources according to need and the inequity and the need to rectify that that is currently happening in the COVID pandemic. And so that's the piece I'm focusing on. I think there's a lot to do, and I would encourage those watching to pick whether it's local or global, advocating for yourself as a leader, advocating for your colleague for a leadership role. There is a lot to do, so jump in.
Right. Thank you, Gabrielle. And finally, Lisa.
I want to just piggyback on this really important point that Kamara made. I remember seeing a presentation that you made, and you have people looking over a fence. And but they all look equal from one side, but on the other side they're standing on different blocks in order to be able to see over the fence, right? And that always stuck with me, because equal does not mean equitable, right? And I think that is actually a really difficult kind of transition for people to get out of their own way, defending, maybe the status quo by, wanting everything to be the same, right? When in fact, some people need more, or some areas of the country need more than I might, right? And so I really just wanted to thank you, because it reminded me of that. As I was saying, we're starting our Women in Global Health chapter here. I really want, for this audience, if you're in Georgia, to reach out. We would love for you to become engaged as we stand up this Women in Global Health chapter. And as our leadership develops a new strategic plan for GGHA, or the Georgia Global Health Alliance, we really want to hear from you, so that we can make sure that we're incorporating your views and what you think are important into our work.
Well, thank you, Lisa, and thank you others, Kamara and Gabrielle, for your insights this evening. I certainly enjoyed the conversation with you all, and also the chat we had with the Congresswoman before you. With that, I'm going to pass things back to Mr. Cameron to close us out for the evening, but appreciation to the audience for participating with us this evening.
Thank you, Loyce. You're a great, great person.
Oh my goodness. Well, I appreciate it. People, I didn't pay her very much for that, so great compliment, Cameron.
Well, I want to say thank you to everyone. This has been a very enriching and engaging conversation. I learned a lot, and given by some of the comments made from people watching live, and even I'm getting random texts and a couple emails throughout people. I'm seeing random different people tuning in, and just really appreciating all of our panelists for joining us this evening. I want to send a special thank you to the Women in Global Health Organization, their executive director and co-founder Rupa Dutt, and all of their staff and volunteers and the various chapter leaders for partnering with us to bring this important conversation to the forefront. Again, thank you to Congresswoman Stacey Plaskett for joining, and all of our panelists. Before I kick it off to Loyce to close, I just encourage everyone to keep up with Hip Politics. You can find us at hippolitics.org. We continue to bring conversations and virtual forums like this to the forefront. We're all about focusing and mobilizing the political power of the hip hop generation. And so that's a very all-encompassing, multi-generational, ethnic culture that we're trying to make sure we engage, empower, and move forward. We also have several different YouTube shows with various speakers. And then also, as you can see behind me, I'm the host of the Hip Politics podcast. So please tune into everything we've got going on, whether it's on social, online. And with that, I will kick it over to Ms. Loyce Williams of the Executive Committee of the Washington, D.C. chapter of Women in Global Health.
Thank you, Cameron. Again, it was such a really enriching discussion. I think from Kamara, Lisa, Gabrielle, and the Congresswoman really had some really great points to things of highlight for a lot of us to think about going forward as we continue to respond to the COVID-19 pandemic, but more so how we reach health equity overall. So again, thank you for joining us this evening. Thank you to Hip Politics for partnering with us. I just want to give a little bit of information about the Women in Global Health DC chapter. We were established in 2018, and as a chapter, we're going to continue to work with different organizations around the world to present relevant events on women's health and gender equity. Our calendar includes at least 2 events per quarter on programs, policies, as well as social networking opportunities. So we look forward to meeting you in the future, of course, once COVID calms down and it's safe for us to gather in a venue as a group. But in the meantime, if you are interested in getting involved with the Women in Global Health DC chapter, please feel free to email us at wghindc@womeningh.org to join our listserv. And please stay safe.
Thanks so much.
Thank you, everyone. Thank you. Thank you. And with that, we only ran 8 minutes over, so it's not that bad. And so with that, we'll close out. And to all our viewers, please share the link and have a wonderful evening.
Thank you.
Thanks.